Anna Bucsics, formerly from the Austrian Social Insurance Institutions. Michelle Goldman mentioned that IMI has a budget of 3 billion euros for supporting pharmaceutical research. And Hans-Georg said that the adaptive licensing process will maybe lead to less expensive clinical trials. So my question is primarily to Stephen Whitehead. Do you think this is going to impact on pricing, that is the way that companies arrive at their prices, or will this algorithm be like business as usual?
I would hope it would impact on prices. If you reduce the R&D costs, definitely, that would be the implication. I mean, the big issue confronting the industry at the moment, as we know, is affordability. And you do have, look like high headline costs of drugs, some of which do have value assessments, some of which don't, and coupled with significant austerity across the whole of the European Union, which is creating somewhat of a crisis. It's a crisis that we as an industry have to engage with, and that crisis is the crisis of affordability. Each country responds differently. So, for example, in the UK, we've negotiated a 5-year pricing scheme for the next 5 years that caps the medicines bill with a rebate mechanism. So therefore, in actual fact, what that means is medicines can be used as much as possible, appropriate to indication, appropriate to patient, and the rebate will come back from the industry. So we're underwriting the medicines bill for 5 years in the UK. That is a major step. And there are similar schemes going on across the EU to help adapt, to help adjust to the issues that we're confronting. This does have an effect on industry margins. That's the issue. It does have an effect on industry margin. The industry is not in a particularly fabulous place financially at the moment, as we can see. But that's the reality we're operating. I think it's the creativity in each market to address that issue is vital. And there are different schemes and different systems going in place across the European Union. The UK has adopted the most innovative approach, which is we are underwriting the growth in the medicines bill, which means medicines approved should be utilised against the appropriate patient.